It started.
Hello,
Hello, doctor.
I'm Dr. Firoz. I'm one of the doctors in the psychiatric department. Are you Emily Taylor?
Yeah, I'm Emily.
Can I confirm your age, please?
I'm 16, doctor.
Okay, so is it okay to call Emily?
Yeah, that's fine.
Mhm. So, Emily, I understand that you are here to this department because you took some oral contraceptive pill. I'm really sorry that you have gone through a lot. Okay, so I'm here to. I just wanted to make sure that you are okay or not. So, can you please take me through what happened actually?
I want to go home, doctor. I don't want to be here. I want to go
Okay, I can
home.
see.
Yeah.
Can s- I can see that you are not looking fine. Can you please take me? Can you please tell me more about it? What is bothering you?
Yeah, I'm feeling fine. I'm all right now. I just want to go home.
Yeah, you should be able to go home. Definitely, will you can go home. But before that, just we want to make sure that you are okay and what has been going on with you. So, can you please tell me what happened with you exactly, or why did you took that oral contraceptive pill?
I don't want to talk about it. I don't feel comfortable talking about it.
Okay, so, Emily, I understand that it's a really difficult situation for you. I'm here to help you, and everything we'll discuss will be confidential. Are you okay to talk about it?
All right. Yeah, what do you want to know?
So, I learned from my notes that you have took some oral contraceptive pill. So, can you please tell me why did you take this pill?
I was really scared actually. I I
Mhm.
I think I missed my periods and I was scared that I was pregnant. So I told my boyfriend that and he got so angry at me and I was so confused. I didn't know what to do. So I had these pills and then I just cut my wrist. I didn't know what to do, doctor.
I'm really sorry about what you are going through. And you mentioned to me that um, so why did you get this oral contraceptive pill?
Well, I take them. I take them
Okay,
regularly.
okay. Okay, and I can see that you have this bandage over your wrist. So can you please tell me why did you cut your wrist? Is there any um,
I told
like
you. I asked. I spoke to my boyfriend, and he didn't react the way I wanted him to. I got so scared. I didn't want to go on and be pregnant and not have his support. I didn't know what else to do. I didn't know, doctor.
Yeah, I understand. It's difficult. So before cutting your wrist, did you make any plan, anything like you write down any notes?
No, it all happened so suddenly. I wasn't sure how I was feeling. I wasn't really in control of my emotions. I
Mhm.
was, a law was going through my head. I just did that.
Mhm. And during that cutting your wrist, how did you feel? Like you feel frightened or anything like that?
I wasn't thinking straight. I know it's a
Mhm.
mistake now. I mean, I didn't feel like that then. I just wanted to end it. I didn't know what I was thinking, so I did that.
Okay, and after cutting your wrist, did you come by yourself or your any family member bring you to the hospital?
No, I got scared. I came by myself. I didn't even tell my
Oh, okay.
mother. I don't know how she would
Okay.
react.
Okay, um, so after are your family supportive?
Well, I live with my mother, and
Mhm.
she is very supportive. I usually tell her
Mhm.
everything, but I don't know how to tell her this.
Yeah, and how about your boyfriend? Is he supportive to you?
I thought he would be. I mean, the way he
Mhm.
reacted, I don't know anymore.
Okay, and how long you have been in this relationship?
It's been almost a year now.
Okay, and may I know his age?
He's also my age. He's also 16.
Mhm. Okay, so, and I understand that, Emily, I
Two
understand that
minutes
you are going
remaining.
through a lot. So, I just wanted to ask you that if the similar situation happen in the future, would you do the same thing or not?
No, doctor. I wasn't thinking straight. I wasn't sure. I wouldn't do it again. I know that now.
Hmm. Okay, and okay, so, do you have any concern at this moment?
I don't know how to tell my mother. I
Mhm.
mean, I don't want to put her through this. I'm just really scared about telling this to my mother.
Yeah, I understand. But you mentioned to me that your mom is very supportive to you. So I think you can talk in a nice way with you about everything. So I think she will understand definitely because parents usually our best supporters. So they will understand about it. Okay, you're getting my point.
I just want to know, will I be. Am I pregnant? Is there any way to find
Yeah.
out?
Yeah, so can I just ask you, when was your last menstrual period?
It was like a month back. I'm some 3 days late now.
So, did you check by yourself? Did you do any test?
No, I just.
Okay.
I've never been this late and I got a little worried.
Okay. May I ask you? I understand this is little bit intrusive question. I just want to make it's important for us to know. So, can I ask you that when was your did was there any unprotected sex in this time?
Yeah,
Move on to the next station.
about 5 days back.
Mhm.
But good job,
Okay.
time is up.
Oh, but why I can't?
Example, like in this, you you know what data gathering you need to ask, but before you even start your station itself, think about what are the main key management points that you need to deliver. So for example, here you understood that this is a suicide risk, so make sure you talk about safety netting. Make sure if you don't mention 24-hour the Good Samaritan helpline crisis plan, if you don't mention the word or not just the word, like the meaning of crisis plan, which is basically, if this happens again, what would she do next time? If you feel like this again, I would want you to call someone, because you shouldn't be going through this again. So if you just mention that word once, that sentence once, that means you've covered the safety netting already, and that is the main management. And other than that, the other management is she's medically fit for discharge, so you don't have to do much. Main thing is we'll make sure we'll get you support and all that you can mention after that.
Okay.
And there is, since the patient is already in front of you, you can do examination. So always mention some
Okay.
examination that you can do. At least do wound examination, because even when you are going to meet a patient in a ward or any place, they would want you to examine them. That is also one way of interpersonal skills, that I'm telling you I have tummy ache, and you just ask me a few questions and you just send me home saying that your tummy ache is because of this. But if you don't examine me, even a patient won't be satisfied. Like, she didn't even touch me, and then she just told me that I have cholecystitis and she sent me home. Right? I mean, because the patient is in front of you, at least to show that, I'm there to help you. Let me, oh, I can see that you have a wound. Can I take a look at it if it's okay? I mean, definitely you want
Okay.
some, like, some, if you're actually, try to put yourself in that position of the, the patient. Like, if somebody's talking to you and you see that there is some wound or something, you say, oh, I'm so sorry, what has happened, can I please see what it is? I mean, you're a doctor, so you can actually examine instead of saying that, can I see, like, can I please examine your hand and see if it's
Yeah, that one I noticed that there is a special note, but I didn't understand why I need to put it.
okay? Yeah, exactly, the special notes, right? So you can examine that. So that's what, no, that they're trying to bring your attention to the fact that, there is something over there, just examine it. And she's also worried that she's, one of the other concerns she's had, that I don't know if I'm pregnant. So you can do a bedside UPT test,
Okay.
right? So because
Yeah.
there are a couple of findings over here. So if you had asked for the findings, you would have gotten. Even though it's given medically fit, since the patient is in front of you, you can actually do a couple of examinations, right? Especially the bedside examinations for the UPT and all that, right?
Okay.
So that way you would be in a better position to ask that, am I pregnant? So you'd be like, so unfortunately, I mean, after doing the urine pregnancy test, which is a test to see if you're pregnant, it was negative. So it's very unlikely that you are. But it can happen that you're, especially since you're on the pill, it can happen that your periods might get delayed. So this case also comes where, she has taken her mother's pills.
Okay.
That's also possible. So that way you will be like, all right, you ask some very important questions like, when was the last time you had unprotected sex? When was the last time you had sex? When was the last time you had unprotected sex? Right? So that way you can ask, when was the last time you had any sexual intercourse? So then you can go on, like, was it protected or unprotected? Then you'll actually understand what is her state of mind. So this is a 16-year-old girl who doesn't understand. I mean, from what she talks, she doesn't understand how to get pregnant properly. Right? Because
Okay.
she's on the pill. She doesn't know whether, it can get delayed. She starts taking rash decisions. So it's a young girl with very little understanding about these things. Your role as a doctor is to bridge that gap of the, misunderstanding and the reality of the situation. Right? So you have to tell her that since you are on the pill, there is very less chances of you getting pregnant, first of all. And second of all, since you are having sex,
We
it
did.
can, you was it protected, unprotected? Again, if it's protected, then there is very less chances, but try to continue having protected sex, because there are, the risk of STI is also less. So you're trying to educate her, right? And sometimes it is possible that, you can get a little late on your periods from time to time. So do not get worried, you can always come back. And if at all you feel this way, you please you can talk to your mother, who seems supportive. You can tell her, or else I'll give you this crisis card. If you feel this way, you can always contact somebody and talk to them, so that you feel better, right? You try, you'll have to come down to their level, understand what their understanding is, and bridge the gap, and help them to, not feel this way, mainly, right? So
Okay.
yeah, because everybody at this point, we're just trying to pass an exam, right? We forget that we are actually dealing with real patients who really are, we're trying to educate them about their condition. And when it comes to younger patients, like a 16-year-old child who takes rash decisions like these, we have to educate them properly, right? And give them the right kind of resources, because that is your management plan mainly. What all resources do you give them? What all openings that you give them, so that they can avail, just in case if this something similar happens. Yeah.
Okay.
And the mother, she's like, I don't know, how do I talk to your mother? How about I help you with that? Right?
Okay.
Because whenever, so these are all cues for you, for you to bring about interpersonal skills. Like, as soon as they say that, I don't know how to, it's like, how about I help you? with that. Initially, I wasn't opening up. You should have started giving confidentiality. Initially itself, when you understand that the patient is not opening up, try to tell them, as soon as there is some, some hindrance towards opening, I don't want to talk about it. I'm so sorry you feel this way, but it's really important that you talk to me, and I can understand your situation. I can help you. I can help you understand your situation better. And then like, no, I don't think so. I'm scared. Like, there's nothing to be scared about. Whatever you say will be between you and between us and my team until everyone's safe. Just mention these things, like, you're
Okay.
literally urging them that, come on, open up to me. I'm somebody you can talk to. I can help you. I have the resources to help you. Trust me. And then you'll have to gain their confidence before they open up. Because if you don't say these right words, they will not open up. They will not open up for like 4 minutes into the consultation. And you'll start getting worried. Trust me, you'll be like, oh my god, what do I tell you? Just tell me what you want to. Like, that's, you have to
Okay.
say the right words, right? Just, trust me, I can help you. I can help you understand your situation better, and whatever you say will remain just between us. Yeah. All right.
Please like and subscribe to TuringMedSchool. Good luck with your preparation.